Hello, look at this slide and try to guess the histology. Which slide is it? So you're able to see some capsule, you're able to see some zones here, a little dark and a little light here, right? So let me give you some more clue. So there's a capsule outside, right? Then you have the medulla inside, and here you have three layers, the zona glomerulosa, zona fasciculata, and zona reticularis. Okay. So what are you looking at? And there is some vein here in the center. So yes, this is the adrenal gland, the suprarenal gland. Okay, so it has medulla and cortex and a capsule. In the cortex, you have the zona glomerulosa, zona fasciculata, zona reticularis. Okay, and there is a vein here in the middle, central adrenomedullary vein. Okay, so the adrenal glands are also called as suprarenal glands because they sit on top of the renal, that is the kidney. So this is the suprarenal. Suprarenal gland are nothing but adrenal glands. So they are important endocrine glands situated right in the posterior abdominal wall over the upper pole of the kidneys behind the peritoneum. Okay, and they have two parts. There are two glands, right and left, and in those inside the gland there are two parts. What do you have? The cortex and the medulla. Very good. So are you ready to look at even finer details of the adrenal histology? How to draw it in the exam especially. So here you can see the capsule. Here they have drawn the cortex and here they have shown the medulla, I'm guessing, right? So in the cortex you have three parts, zona glomerulosa, zona fasciculata, zona reticularis. So the way to remember it is GFR. Okay. So here you can see, where did it go? GFR. GFR is glomerular filtration rate, but this is not a kidney, okay? But this is just a code word to remember. Zona glomerulosa, zona fasciculata, zona reticularis, okay? Now you have to draw some pillar-like structures like this with some head on top, something like this, okay? So in pencil, we've just tried to scribble. So now let us try to draw. So here you will have something like a balloon like this. A lot of balloons like this, a lot of balloons like this. And you'll have to draw cells all around this part. Polygonal actually. I'm not drawing polygonal. You have to draw polygonal cells, polygonal cells, polygonal cells. And here you have drawn some cells which are columnar, looks like. Maybe hold on. Like this, columnar cells they are showing here. Okay, so basically you got the point, right? So the cortex, it consists of three zones. Yeah, you're like, okay, I was saying it the 100th time. We already know it. Zona glomerulosa, zona fasciculata, and zona reticularis. Yes, but what is there in zona glomerulosa? In zona glomerulosa, you have the columnar cells with spherical nuclei. I don't see spherical nuclei. Incorrectly drawn, I think. Okay, then middle zone or zona fasciculata has cells arranged in vertical rows. Cells have lot of vacuoles in cytoplasm. Okay, that we are able to see vacuoles in the cytoplasm. Okay, the inner zone, that is the zona reticularis, it has some cells in anastomosing network. These cells are less vacuolated. Yeah, these ones in the middle are very, very vacuolated, lot of white. Okay, so now let us look at the medulla. Medulla, what does it have? What does medulla have? Medulla has chromaffin cells and sympathetic ganglion cells. Chromaffin cells and sympathetic ganglion cells. So the histology is done, guys. Now let's move on to some clinical part, actually what it does. What does the adrenal gland do? Okay. Okay, so here you go. So this is the adrenal gland. If you have spotted it, yes, who is controlling it? The pituitary gland in the brain, right, in your head. And who is controlling the pituitary gland? The hypothalamus is controlling. Hypothalamus is releasing CRH, that is corticotropin releasing hormone, right? And that will make the pituitary release ACTH, that is adrenocorticotropic adrenocorticotropic hormone. So it is going to affect what? The cortex, right? Adrenocortic, adrenocorticotropic hormone. Okay. Now, what is this going to do? The cortex has three parts, right? So each part is releasing a separate thing, hormone. So zona glomerulosa is releasing mineral corticoids. Actually, we sometimes say mineralocorticoids. Okay, mineral corticoids, very important to know. Aldosterone. So aldosterone will make you retain sodium. So it will make sure that you absorb more water, right? Sodium means it will, so wherever sodium goes, water goes. So if sodium is going to be there in your body, more water will be retained. Hence your blood pressure could be more. It will kick out all the potassium. So that is its job. Now coming to zona fasciculata of the adrenal cortex, it is going to produce what? Focus here, people. Where? Here. We are in zona fasciculata, in the middle. So it is going to produce what? Glucocorticoids. So these are going to increase your glucose. And what does it produce? What is it producing? The exact hormone, cortisol. You just remember cortisol. So these are also, it's a steroid kind of a thing, right? So these are going to reduce the immunity of your body and reduce inflammation also. And they're going to promote lipolysis. Now coming to the third zone, of the adrenal cortex, that is reticularis, zona reticularis, it's going to make androgens. So for becoming more masculine, we put a mustache here. So you have androsterone, dihydroepiandrosterone, is it? Wow, what a name. Okay, then coming to the medulla. So we have reached the medulla, people, of what? Which medulla? Did we go into earth? No, we went into adrenal gland from outside. Okay, so what is there in adrenal gland? Those two cells, chromaffin cells and sympathetic ganglion cells. Okay, so these are going to release epinephrine and norepinephrine. Sympathetic, we already knew that. Stress hormones, epinephrine, norepinephrine. Flight, fight, fright, all that. Okay. So just to say why these cells are called chromaffin cells in the medulla, because they are having some affinities to some salt of chromic acid, it seems. Sounds like some color. Okay, so if they ask you some conditions of the adrenal gland for clinical anatomy, what will you write at the end? Clinical anatomy, you can write Cushing syndrome. Cushing syndrome means what? So much of adrenal excess cortical secretion. Okay. Now, if there is insufficiency, you'll have Addison's disease. Okay. So both you can write in the clinical anatomy part. In the histology, always at the end you should write this, right? Hyperglucocorticism, Cushing syndrome, Addison's disease is insufficiency of cortical secretion. Okay. Okay, bye-bye. See, adrenal gland produces adrenaline, correct? Where is that here? Here, where is that? Epinephrine. Epinephrine is nothing but adrenaline. Okay, it's coming from adrenal medulla. Okay, so adrenal medulla produces the adrenaline and noradrenaline, okay, which are the stress hormones.